So in this PowerPoint, we are going to discuss the pediatrics oncology. The most common pediatrics cancer are nephroblastoma. Nephroblastoma, actually the cancer tumor in the kidney or in abdomen. Another one is neuroblastoma, most common in the pediatrics. This is the cancer that is commonly found in adrenal gland. The soft or bone tissue cancer in pediatrics is called Osteosarcoma. And another last one is here, we are going to talk brain tumor. So first one is nephroblastoma. So before to go this PowerPoint, I want to share most common information frequently asking the board question about the nephroblastoma. Keep in mind, nephroblastoma, it is most of the time non-tender malignant mass in the kidney. You see the picture? The malignant mass inside the kidney. And we can feel in the abdomen near the liver. If we see the patient has a nephroblastoma or Wilms tumor, do not palpate. The mass may be ruptured. If the children develop nephroblastoma, the treatment is nephrectomy and chemotherapy. This is the most common information NCLEX board asks. Now let me read it with you. What they said. Nephroblastoma or Wilms tumor is the most common intra-abdominal and kidney tumor of childhood. It may present unilateral and localized or bilateral, sometimes in one kidney or maybe both kidney, and sometimes metastasis to the other organ. But keep in mind, metastasis is very uncommon. The peak incidence at the 3 years of old and occur is associated with a genetic inheritance with the several congenital anomalies. So the children who have nephroblastoma, they have a chance to develop any other congenital abnormalities or anomalies. The therapeutic management include a combination treatment of surgically remove, like total or partial nephrectomy. Sometimes total kidney remove is called total nephrectomy. Sometimes part of the kidney to contain the tumor is removed. This is called partial nephrectomy. And also give the chemotherapy with or without radiation. So there are three options: surgically remove, chemotherapy, surgical remove with chemotherapy or with radiotherapy. So NCLEX board asks question, if your patient has to take chemotherapy, what are the nursing care and teaching? If your patient need radiotherapy, how we take care of them? I'm going to explain each and everything, and because it is important for NCLEX board exam. In this picture, you can see a baby develop the nephroblastoma. And if you palpate, you can see a big mass, right? frequently a question come, and every student must know, if your baby have a nephroblastoma, if you suspect it, better do not palpate. Why? The chance this mass or tumor be rupture, right, and cause a complication. The other sign and symptom of nephroblastoma, sometimes patient have a hypertension, hematuria means blood, urine mixed with blood, patient develop fever, patient feel malaise, right? So what are the other sign symptom? Sometimes, first one here, let me recap it for you. If you palpate, we can feel this palpable mass is a firm and non-tender abdominal mass. Patient complain the malaise, fever, and hematuria. This is the sign and symptom, right? So let me read it. A swelling or mass within the abdomen. The mass is characteristically firm, non-tender, and confined to one side and deep within the flank area. So this side is a flank, kidney flank. So patient develop urinary retention or hematuria, anemia caused by hemorrhage within the tumor, right? Anemia develop as well because kidney has an important function to maturation of red blood cell. So also, what are the other sign symptoms? Pallor, anorexia, lethargy, hypertension. Hypertension causes by secretion of excess amount of renin by the tumor. So you know the malignancy or cancer means excess production of the tissue. When excess production of the tissue or cell, they can produce excess amount of renin. And by the tumor, other sign and symptom, weight loss and fever, right? The symptoms of lung involvement, such as the dyspnea, shortness of breath, pain in the chest, if metastasis occur. But I told you the Wilms tumor metastasis is very uncommon, right? Next here, the pre-operative intervention and post-operative intervention. So before to go the intervention, I love to share something. We can diagnose the nephroblastoma by abdominal ultrasonography or ultrasound or CAT scan. And also bone marrow aspiration can rule out the metastasis. So what next? How to take care of patient before surgical remove or after operation? So the NCLEX board asks the question, how to take care of them? So do not palpate the abdomen if Wilms tumor is suspected, right? And as per I told you, the treatment option is surgically remove the tumor or pre-operative or post-operative chemotherapy with or without radiotherapies. So let me read. We could monitor the vital sign, particularly blood picture. Avoid the palpation of the abdomen and place the sign at the bedside that read as follows: do not palpate. We are talking about do not palpate because it is very important. Do not palpate. Its chance of rupture and causes a life-threatening complication. Also measure the abdominal gait at least once a day. Means increase the size of the growth or not. Post-operative, when patient done the surgery, how to take care? Monitor the temperature and blood pressure closely. Monitor for sign of hemorrhage and infection. Monitor the strict intake and output closely. Monitor for abdominal distension, bowel sound, and other sign of GI activity because of risks for intestinal obstruction. Also avoid palpate of abdomen in the child with Wilms tumor and be precursor when take the bath, movement, handling the child. It is very important keep the encapsulated tumor intact. Rupture of the tumor can cause cancer cell to spread throughout the abdomen or lymph system and bloodstream. I'm going to discuss the another tumor is called neuroblastoma, right? And neuroblastoma is the cancer that commonly found in adrenal gland. So in this picture, you can see the kidney. Top of the kidney, the gland is called adrenal gland. So neuroblastoma, the tumor inside the adrenal gland, right? Commonly found, I said. So you see a tumor that origin from embryonic neural crest cell that normally given rise to the adrenal medulla and sympathetic ganglia. So this is the spinal cord and spinal cord distributed to the gland. So the embryonic neural crest cell tumor and normally give rise to the adrenal medulla or commonly found is adrenal gland. The most tumor develop in adrenal gland or retroperitoneal sympathetic chain. Other side may be within the head, neck, chest, or pelvis. Let me recap it. Neuroblastoma are the cancer tumor in the adrenal gland, and it is manifest in toddler year or preschool year, and in many cases has metastasized before diagnosis, and that is the dangerous. Usually, patient present with some of sign and symptom, like half of the children have a very few symptom. Sign symptom of metastasis, that would be too late. And sign symptom of metastasis like malaise, periorbital ecchymosis, or bone pain. So I have picture, you can see this one, symptom. It is periorbital ecchymosis. let me go back. The most children present with this tumor before 10 years age, preschooler. Most presentation signs are commonly by the tumor compression at just normal tissue or organ. Diagnostic evaluation is aid to locally the primary site of tumor. The prognosis is very poor because when the disease occurs at the beginning, there are no sign and symptom. When sign symptom present, it will be already metastasized. So they said prognosis is poor. Why? Because of frequency of invasiveness of the tumor. Why? In most cases, the diagnosis is not made until after metastasis has occurred. Right? Younger the child, a diagnosis, better the survival rate. So, I want to recap it for you. The patient, when present to the doctor office, they have the sign symptom of metastasis is more common. What are the sign and symptom of metastasis? I said patient may be present with lump in the abdomen or lump in the chest area. Patient present with the low back pain or periorbital ecchymosis or bruising around the eye. You see, bruising around the eye. This is the baby bruising around the eye. Usually, we diagnose this disease by CAT scan or skeletal survey, bone marrow aspiration to rule out the metastasis. Usually the treatment is surgically remove the tumor, or we can give chemotherapy and or radiotherapy if the metastasis occur. Let me read the PowerPoint for you. So they said the treatment option is surgical or radiation or chemotherapy. Let me redo or recap a little bit more. So the treatment option or first choice is surgically removed, right? So surgery is performed to remove as much the tumor as possible and to obtain sample for biopsy, right? When you remove the tissue and you can check the biopsy, you can categorize what type of cell it is, malignant or benign or others, histopathology. Surgery is usually limited to biopsy in the later stage because of extensive metastasis, right? So you are not allowing go for surgery any stage of the tumor. If metastasis all over the body, it does not make sense you go for surgically remove the tumor. So radiotherapy and chemotherapy. I'm going to talk about radiotherapy and chemotherapy for neuroblastoma, but same information we need for nephroblastoma or osteosarcoma or any other pediatrics tumor. So first of all, radiation. Radiation is commonly used with late stage, right? And provide palliation or palliative care for metastasis lesion, especially in the bones, lungs, liver, and brain. So what are the nursing care? So when you go to take care of your patient who need the radiation therapy, always you wear the lead apron, right? You could wear the lead apron when radiation is used. Also, you can educate your patient or parents of the patient, because we are talking about the pediatrics client, right? So what you could teaching, inspect the skin daily. I mean, watch the intragumental system of skin. Do not wash the marks of the skin. Wash the skin with lukewarm water using hands and avoid cold or hot water. Avoid use of soap, lotion, or powder. I said avoid. Also wear the loose cotton cloth. Keep the area protected from the sun, and also notify provider for blister or wrapping the skin, right? Chemotherapy, if the patient need chemotherapy, what are the care and teaching for chemo? So chemotherapy is used for the treatment for extensive local or disseminated disease. So like cancer is metastasized all over the body, right? Keep in mind, after chemotherapy, patients have developed some side effect like nausea, vomiting, GI upset, loss of appetite, mouth sore, or hair loss. Patient feel fatigue and develop pancytopenia. So keep in mind, we can provide antiemetics because chemotherapy can cause nausea and vomiting. You give them something can stop the nausea and vomiting, right? Nausea and vomiting. And also mouth care is important. Infection control is important. And if the patient develops the bleeding, we could control the bleeding as well. Let me read here. If patient has neuroblastoma, what are the sign and symptom? And sign symptom depends on the stage or tumor metastasized or not. It is firm, non-tender, irregular mass in the abdomen. Keep note, most of the tumor is painless, non-tender. Urinary frequency or retention from compression of the kidney or ureter or bladder. Patient develop lymphadenopathy. So lymph node palpable, getting bigger and large, especially in the neck area, cervical or supraclavicular area. Patient complain of bone pains, you see, low back pain, if it is metastasized to the bones, because the bones is very close to the tumor, easily metastasized. Supraorbital ecchymosis. Supraorbital, you see, eye is called orbit. Around the eye, patient develop pallor, weakness, irritability, anorexia, weight loss. the sign of respiratory impairment is common, like thoracic. Like here, the thoracic lesion, easily respiratory impairment occur, obstruction. Also sign of neurological impairment if it is intracranial lesion, or paralysis from compression of the spinal cord. So when the tumor getting bigger, they push pressure on the structure and compression occur in the distribution areas. The symptom of neuroblastoma showing the picture, same thing I already mentioned. So in the first picture, you can see a mass or lump in the abdomen. And the second picture, you can see the lump in the chest area, right? And the third picture, low back pain. And this one is periorbital ecchymosis. So here I said we can diagnose this tumor by CAT scan or skeletal survey, like this back pain or bone marrow aspiration can rule out the metastasis. So next here, how to take care of patient if patient develop this problem. Monitor the sign and symptom related to location of tumor and provide emotional support. Definitely. The patient condition is really bad if it is metastasized. Because of our profession, we could help them to recover psychologically, right? As possible. So emotional support is very important for the patient and also for the parents. Post-operative intervention, monitor for post-operative complication related to the local organ of surgery, monitor for complication related to the chemotherapy, right? Or provide support to the parents, encouraging them to express their feelings. Many parents feel guilty. Why they feel guilty? Because when disease is diagnosed, it would be too late because of metastasis. They thought because of their ignorance, they came late to the doctor office and they diagnosis the metastasis cancer because of neuroblastoma. So here that they said, monitor the complication related to the chemotherapy, right? So let me recap a little bit. The chemotherapy patient have a problem of mouth sore. They develop mouth ulcer. So provide the soft, if the patient develop the mouth ulcer, we can provide soft toothbrush or non-acidic food. And food should make soft and bland. And also provide the frequent oral care, lubricant lips with lip balm, or apply the topical anesthetics if the sore throat develop, encouraging some mouthwash or salt raising the mouth. If patient develop infection because of pancytopenia, infection control is very important. Tell your patient to avoid public crowd area. Avoid the fresh fruits and vegetables. Maintaining food hand hygiene, or limited the visitors or scan the visitor for infection, and we can report the healthcare provider if body temperature is more than 37.8 degrees Celsius. Sometimes patients develop the bleeding because of pancytopenia, thrombocytopenia. So avoid invasive procedure, avoid non-steroidal anti-inflammatory medication like aspirin. Also use the soft toothbrush, monitor for the bleeding. That's it, the care, post-operative care. Another tumor for the pediatrics, and that is called the soft tissue tumor, right? So this is the soft tissue tumor. I said the bones and soft tissue cancer, there are three common cancer. One is called osteosarcoma or osteogenic sarcoma. Osteo means bones, right? Osteo means bones. So here we go next. Another tumor is called Wilms tumor and Rhabdomyosarcoma. So in this picture, we can see osteosarcoma. Osteo means bones, right? The tumor in the bones. The most common bone cancer in the children is called osteogenic sarcoma or osteosarcoma. This is the cancer of the long bones. Usually, patients complain of pain, weakness, swelling. Swelling where? Swelling in the extremities, because this is the cancer of the long bones. In this picture or radiography, we can see this is the bones joint, right? And the broken area, distracted. So, I mean, the radiological feature of conventional osteosarcoma, we can see. So, if we go in this radiography or demonstration by radiography, we can see the medulla and cortex, bone destruction. It is very aggressive periosteal reaction. A soft tissue mass and bones tumor either within the destructive lesion. So this is soft tissue and bones both get involved in this picture, right? So here, this is the surrounding area, the soft tissue mass, and this area is the medulla and cortex, destructed. So here is, let me read, usually found in the metaphysis of the long bones, especially in lower extremities, with most tumor occur in the femur or peak age of incidence in between 10 to 25 years. The symptoms during early stage are almost always attributed to extremity injury or normal growing pain. Treatment option may surgically resection or chemotherapy, right? So keep in mind the chemotherapy, or we can go for the remove the tumor, limb resection, or also chemotherapy to shrinking the tumor, then bones on joint replacement or amputation is common. right? So chemotherapy is used to treat the cancer and may be used before and after surgery. I already mentioned how to take care of chemotherapy patient, take care of teaching. But it is very important, if anybody have a chemotherapy, there are a lot of side effects, especially patient develop pancytopenia. Pancytopenia means bone marrow, pancytopenia develop because of bone marrow depression. Bone marrow can produce different kind of cell, right? I can show you a picture so you can easily understand. So okay, this is the bone marrow. When bone marrow does not produce the cell, bone marrow produce platelet, bone marrow can produce red blood cell, bone marrow can produce white blood cell. But if patient bone marrow suppression is occurred, bone marrow does not produce the cell, that times patient develop anemia, neutropenia, and thrombocytopenia. So like here I said, bone marrow can produce platelet, but if bone marrow does not produce the platelet, patient develop thrombocytopenia, means decrease in platelet and causes an increase the risk of bleeding. So if you see your patient is bleeding, it indicate platelet go down, thrombocytopenia develop. If bone marrow can produce red blood cell, and red blood cell has a hemoglobin, but if bone marrow does not produce red blood cell, so hemoglobin level go down and patient develop anemia. Anemia, why? Because decrease the red blood cell and patient complain of fatigue, tired, shortness of breath. And bone marrow also produce white blood cell. There are several components in white blood cell like neutrophil, basophil, eosinophil, but neutrophil is most important. They fight with infection. When white blood cell go down, patient develop neutropenia, means decrease in white blood cell count and causing increase the risk of infection. If you see your patient have a frequently attack the infection because of chemotherapy, indicate bone marrow suppression occur and patient develop fever. So high grade of fever indicate patient has the infection, right? Let me go back in my PowerPoint first. So we are talking about the osteosarcoma here. So chemotherapy can cause pancytopenia, and pancytopenia means anemia, neutropenia, thrombocytopenia all together, right? So another or two more common tumor in the bones and soft tissue, one is called Rhabdomyosarcoma and Wilms sarcoma. So Wilms sarcoma is a cancer of the shift of long bones and trunk of the bones. Usually patients have a complaint of pain, weakness, swelling of the extremity, as like as osteosarcoma, same sign and symptom. And also the treatment is biopsy, radiation, and chemotherapy. The other tumor is called Rhabdomyosarcoma. This is the cancer of the skeletal muscle, or most common in the neck, head, and eye. If the patient has a rhabdomyosarcoma, patient usually complain of headache, some symptom, sign and symptom related to the eye, like double vision or diplopia, then proptosis, stigmas, or pain, or chronic otitis media, or pus discharge. As like as Ewing's tumor, the treatment for rhabdomyosarcoma, biopsy, radiation, and chemotherapy. What next? Let me focus a little bit more about osteosarcoma. So data collection, localized pain, palpable mass, progressive limited range of motion, child may be unable to hold the heavy object, and pathological fracture. Let me read it for you. Localized pain at the affected site that may be attributed to the trauma, right? Or vague complaint of growing pain. So vague complaint means it is hard to distinguish. Palpable mass, what we see in this radiography, palpable, swelling, distracted. Also limping if weight-bearing limb is affected. Progressively limited range of motion. Child may be unable to hold the heavy object, or pathological fracture at the tumor site. Now let me explain the intervention. So NCLEX board frequently asks the question about the intervention. So prepare the child and family for prescribed treatment, including surgical resection or remove the affected tissue, we call it amputation, and or with chemotherapy. Communicate the honestly and provide support to the child and family. So psychological support is very important. Motivation. Prepare for prosthetic fitting if amputation is occur. Assist the child with dealing with the self-image problem, right? Also reinforce instruction to the child and parents about the potential development of phantom limb. Phantom means artificial limb. And patient complain the phantom limb pain. This is the most challenging to face. That may occur after amputation and characterized by tingling sensation, itching, or painful sensation in amputated legs. So we could give them the management, how to manage the pain. Basically, we give them pain medication like morphine, pethidine, or non-steroidal anti-inflammatory medication like ibuprofen. So next, here we go to talk about the brain tumor, right? So pediatric brain tumor. So the description is here. An infratentorial tumor, the most common brain tumor, infratentorial. Infratentorial is located the posterior third of the brain, primarily cerebellum, and brainstem, and account for infrequency of symptom result from increased intracranial pressure. So if your patient have a infratentorial tumor or tumor in cerebellum or brainstem, the common sign or first sign increase the intracranial pressure. So pressure inside the brain. Another brain tumor is called supratentorial. Supratentorial tumor is located within anterior two-thirds of the brain, mainly in the cerebrum. So in this picture, you can see this is the membrane separate the brain. This membrane is called tentorium. So the structure of the tentorium is called supratentorial, especially cerebrum. The structure below the tentorium is called infratentorial, especially cerebellum. In this picture, telling what are the content of supratentorial compartment, what are the content of infratentorial compartment. This area contains cerebrum or brain stem, fourth ventricle as well. In the supratentorial contain cerebral hemisphere, basal ganglia, or lateral ventricle, hypothalamus, and corpus callosum. We are categorized the brain tumor. One group is called infratentorial, especially if the tumor occur in this area, or cerebellum or brainstem. Another is called supratentorial. If tumor occur in this area, means cerebral hemisphere, it's called supratentorial. Cerebral hemisphere or cerebrum. Both tumor, the primary and common sign, increase the sign and symptom of intracranial pressure. So the sign and symptom of brain tumor depends on its anatomical location and size. To some extent, the age of the child or number of tests may be used in neurological evaluation, but most common diagnostic procedure is MRI. It's called magnetic resonance imaging. So by MRI, we can find out where the accurate location of the tumor, the size and shape of the tumor. The treatment option, at the beginning, if possible, we can try to surgically remove. If not possible, we can go for radiotherapy with or without chemotherapy. Treatment of choice is the total removal of tumor without residual neurological damage. This is the treatment option. So in this PowerPoint, we basically learn what are the difference between supratentorial and infratentorial of the brain, right? It is new to you. So I said in anatomy, in this picture, the supratentorial region of the brain is the area located above the tentorial cerebri. The supratentorial region contains the cerebrum or cerebral hemisphere, while infratentorial region contains the cerebellum. That's it. So next here. Next, they talk what are the sign and symptom of the brain tumor. or data collection. The patient who develop the brain tumor, you see the tumor develop inside the brain. Easy way to remember and very important for your NCLEX board exam, the patient who have brain tumor, they develop the sign and symptom of increased intracranial pressure. So this is the brain, and brain is covered by a cerebrospinal fluid. If the tumor develop or any other pathology like meningitis, the common sign increase the sign and symptom of the increased intracranial pressure. As a RN or LPN for NCLEX board, you must know what are the sign and symptom of intracranial pressure. Most of the times, patient present with a headache or confusion, or patient develop increase the blood pressure. So again, let me recap it. If patient has increased the intracranial pressure, we can, if you check the blood pressure will be go up, but the pulse go down, respiratory rate go down. When blood pressure go up, but pulse go down, respiratory rate go down, these three together is called Cushing triad. What are the other signs? Like headache, vomiting, behavioral change. Because like the tumor this area, there's some important nerve supply this area, nervous tissue. So the nervous tissue where they distributed, this function will be impaired. Also facial weakness, double vision, diplopia, or involuntary movement of muscle, and this is called seizure. So as an RN or LPN, your responsibility to monitor the patient, nursing care. If you see any sign and symptom of increased intracranial pressure in the child with a brain tumor, we always notify to the healthcare provider. This is the first priorities, right? So now I'm going continue. What are the pre-operative intervention? What are the post-operative intervention? You see, this is the brain tumor, how big it is. World's largest brain tumor successfully removed. This is the progress of medical science. So we could monitor the neurological status, level of consciousness, or any abnormal neurological sign. Check the seizure. If patient has seizure, the first priority, seizure precursor. Safety is most important for the patient. Monitor the weight and nutritional status. The child head will be shaped, and you can educate your patient before surgical operation. Tell your patient after surgery, after few hours, you can see a big bandage in your head. Shaving head may also be done in the surgical area. Prepare the child as much as possible and tell the child that he or she will wake up with a large head dressing. What next? Post-operative intervention. So after surgery, what we could do? Monitor the neurological and motor function and level of consciousness. Monitor the body temperature. It is very important. Why? Because it may be elevated. Body temperature may be elevated as a result of hypothalamus or brainstem. And brainstem involvement during the surgery. Maintain a cooling blanket by bedside. Monitor for sign of respiratory infection. Also monitor for sign of meningitis. So most of the times I tell my student, if you do not know the sign of meningitis, it is better to do not go for the board exam. So the clinical sign we could do the Babinski sign or Karnik sign should be positive. Before go Babinski or Karnik sign, I want to tell you what are the other signs of meningitis in the children. So we can see the neck stiffness, or patient have developed fever, or extreme sleepiness, bulging frontally, or shivering, and cold the hand and feet. But most important is positive Karnik sign and Babinski sign. The Karnik sign means the Karnik sign is one of the physically demonstratable symptom of meningitis, right? So several stiffness of hamstring muscle caused an inability to straighten the leg when the hip is flexed to 90 degrees. So I said the Babinski sign and Karnik sign is most important, but when I will discuss the meningitis, but there I explain more. So also monitor the sign of increase the intracranial pressure or hemorrhages, and check the back of the head dressing for posterior blood collection, and notify the healthcare provider or RN immediately if we can see increase the sign of intracranial pressure, right? So it is very easy to check the increase the intracranial sign. As I told you, blood pressure go up, temperature go up, but pulse rate go down, respiratory rate go down, right? So next is here, post-operative intervention continue. Monitor the papillary response. Sometimes papilla is dilated and unequal pupil are reported. If any unequal pupil reported immediately, because they may indicate increase the intracranial pressure. Also monitor for colorless drainage on the dressing, right? Or any kind of secretion came out through the ear or nose. You have to exclude, is it CSF or any other secretion? If the secretion contains the cerebrospinal fluid, it is very important, notify healthcare provider. Keep the document. So how you can find out it is CSF or any other fluid? You can check the glucose level by dipstick test. So when you check for the presence of glucose in the secretion, if it is positive, it indicates it is cerebrospinal fluid. And we need to take care immediately. Also check the healthcare provider prescription for positioning, include the degree of neck flexion, right? Neck flexion means we could check patient has any kind of, I said the Babinski sign positive or negative, right? So next, monitor the IV fluid closely to prevent the volume overload. Here showing the promote the measure that prevent the vomiting. Vomiting increase the intracranial pressure and risks for incision rupture. In this picture, you can see after removal of brain tumor, incision is done. The suture line. So if patient had increased the intracranial pressure in the brain, they have a tendency of vomiting. If pressure is increased in the brain, if vomiting is too much, the chance of rupture of the suture line is the complication. Also, we can provide the quiet environment. If patient complain the pain, we give them analgesia. Provide emotional support to the child and their parents, and also promote maximum functioning of the child. So this is more than enough about the brain tumor for NCLEX board exam.